should mean that the President and Nancy Pelosi should listen to the American people. I was disappointed to hear the President and the Speaker to say that they will move ahead and do it all by themselves. They will not. That's a mistake for the American people. So I thank you for being here tonight so that we can hear back from you about the ideas that you have and about the ideas that are working in the free enterprise system. Thank you for being here, and God bless you.
Please give a warm welcome to Congressman Jeb Hensarling.
Thank you, Dr. Goodman, and as we say in Congress, everything has been said, just not everybody has said it. So it's my turn. First, not that I needed any proof points that Sam Johnson is a rock star in Richardson, Texas. I want to thank my colleague Sam for inviting me and our other colleagues as well. I want to thank you for taking time away from your family, taking time away from your business or whatever else you had to do to be here tonight. This is a critically important debate in our nation's history. I mean, we're not just talking about 1/6 of the economy. We're talking about your spouse's health, your children's health, your grandchildren's health. Regardless of what side you're on in the debate tonight, where you end up in this debate, please know that the right to petition your government for the redress of grievances is enshrined in the First Amendment to the United States Constitution. All due respect to the Speaker of the House and the Majority Leader, it is not un-American to raise your voice and be heard in this debate. First, I think one thing you've heard from us, we all agree health care reform is essential. Medicare's going broke. Medicaid's going broke. There are people with pre-existing conditions who cannot get coverage. But what's important for Congress to do is to do what doctors do, and that is take their own Hippocratic oath, first do no harm. So as important as it is to get this done quickly, it is far more important to get it done correctly. Now, I come to this debate with an open mind, but I do not come to this debate with an empty mind. And I am unalterably opposed to H.R. 3200, period. Congress votes for a public option, you're going to end up with 50% of that equation. You're going to end up with public, you will end up with no option. Mark my words. Second of all, it will lead to rationing as they have in the UK and in Canada. Quality for healthcare. Fewer doctors will choose to practice medicine. There will be less innovation. And at a time, as Congressman Sessions says, we're facing the highest unemployment rate in a quarter of a century. Why would you want to impose $1 trillion cost on this economy when 75 to 80% of the people are happy with the health care they have? The goals we ought to have as a nation with healthcare are simple. We want to get you the healthcare you need, when you need it, at a price you can afford, and every American should have the opportunity to have a health care package no worse than their United States Congressman. So I'm happy to be with my colleagues here tonight who are offering innovative solutions, but we're at a fork in the road. And we're either going to empower the government to make healthcare decisions for us, or we're going to empower the individual in a competitive marketplace, which doesn't exist today, to make choices for them and their family. Now, I got to tell you, if you like the way the federal government is running AIG, GM, Fannie Mae, and Freddie Mac, if you want those people to be in charge of your children and grandchildren's health care, so be it. For my family and for my country, I have higher hopes and higher aspirations. Thank you very much.
Thank you, gentlemen. Tonight, all of you should have received a bookmark that looks like this, and it's an invitation to go online and sign petitions. 1.2 million people have signed this petition. Nothing like this has ever happened before. Just out of curiosity, how many of you have already signed it? That's quite a lot. But then again, a number of you haven't. So take advantage of this. Next week, Mike Gallagher, Bill Bennett, and my colleagues at the National Center for Policy Analysis are going to take the results to Washington. I don't know if you know what it looks like to print out 1.2 million names and put it in boxes, but it fills 30 cartons. And we're going to deliver a set of 30 cartons to Speaker Pelosi. And another set to Harry Reid. All right, now we want to turn to our panel of experts, and our first expert tonight is Eddie McBride. I'd like to ask each of you to hold your comments to 5 minutes, if you will. Eddie McBride is president of the Lubbock Chamber of Commerce, and they're doing some really interesting things out there that I think we all need to know about. Let's give him a big hand.
Dr. Goodman, and on behalf of the Lubbock Chamber of Commerce, this is really a treat for this West Texan to have a chance to be on this stage tonight with these distinguished members of Congress and my fellow panelists. I'm very honored to be able to do this. And the chance to represent small business and our private sector healthcare model at this hearing is extremely important for us as well. We also bring greetings to you from Congressman Randy Nagelbauer, who proudly represents the 19th District. 4 years ago, the Lubbock Chamber of Commerce pursued an innovative, community-based solution to the rising cost of healthcare for our member businesses. As we began working, our chief objective for the collaboration was to ensure two distinct priorities. One was an affordable, sustainable, member-directed plan that would reduce the number of uninsured. The second was a plan that was flexible and offered quality healthcare by including Lubbock's two competing major chamber member hospital systems, which was extremely important. Thanks to our experience, we firmly believe that due to regional and market differences, there can be no one-size-fits-all solution to healthcare reform. Any reform measures that must provide the flexibility to tailor benefits and design solutions best suited to different regions of the U.S. and different market conditions throughout the United States. We are working with our two private, nonprofit co-ops and our insurance provider, First Care Health Plans, to sustain our pool and still appeal to new groups. We believe new strategies are required to continue the direct balancing act of keeping the health plan's risk and its mix of groups at manageable levels in order to sustain our plan. Actuarially, our initial goal was to enroll at least 2,000 lives, and enrollments now roughly number 900 businesses and 10,000 lives.